Hi, my name is Francisco Lopez Jimenez. I'm the director of the Division of Preventive Cardiology at Mayo Clinic, and I will be talking about obesity and why obesity is important to be identified in the clinical practice, among several other important questions. So, why is the recognition of obesity important to prevent or manage cardiovascular disease? Obesity can cause many changes in the physiology of our bodies. And those changes can lead eventually to cardiovascular disease. But let me just briefly review some of those changes that obesity causes in our physiology. The first one is that obesity increases the circulating volume of blood and plasma. And the reason is because adipose tissue will require extra circulation, and that itself will increase the overall amount of blood that is circulating in the body. Obesity also changes our lipids in a way that will create an atherogenic pattern, increasing triglycerides, increasing total cholesterol, and decreasing HDL. Obesity can also cause left ventricular hypertrophy, and that might actually occur independent of blood pressure or the presence of hypertension. Obesity can indeed trigger some cellular mechanisms that will signal the heart to become thicker. Obesity can change the levels of leptin, increasing leptin and decreasing adiponectin. And those hormones are intrinsically related to the control of body weight and might actually increase inflammation and lead to other hormonal changes. Obesity can also increase insulin due to insulin resistance that might lead to type 2 diabetes. Obesity can increase the level of C-reactive protein as a manifestation of systemic inflammation. This might be due to the infiltration of the liver and also deposits of fat in other areas where it wasn't supposed to be, like the abdominal cavity, around the heart, and other areas that might actually lead to increased systemic inflammation. And finally, obesity can increase the level of adrenaline. It will increase the stress system in many different ways. And the combination of all those pathophysiologic mechanisms can eventually lead to hypertension, diabetes, dyslipidemia, and obstructive sleep apnea. Obstructive sleep apnea actually might be caused just by the mechanical effect of increased adipose tissue in the neck, but may also be related to other neurohumoral changes that occur when obesity happens. So those disease mechanisms will lead to the other conditions listed here in blue that we consider causal mechanisms leading to heart disease. Now, obesity has been traditionally blamed for coronary disease in particular, but obesity can cause all sorts of cardiovascular diseases, and I will list just some here. So again, it has been traditionally linked to coronary disease, but it's not the only condition that is associated to obesity. Obesity can actually cause sudden death by different mechanisms. One of those is infiltration of the myocardium by adipose tissue. Obesity can cause congestive heart failure due to a number of changes, including the increase in circulating volume, also increasing the catecholamines and hypertension and other things that will eventually lead to congestive heart failure. Obesity causes atrial fibrillation. And we know this because people with paroxysmal atrial fibrillation who lose weight actually have less burden of atrial fibrillation down the road, or might actually prevent recurrent atrial fibrillation just by losing weight. Obesity might cause dilated cardiomyopathy, which is intrinsically related to the likelihood to develop congestive heart failure. And indeed, individuals who are seriously obese, who develop heart failure and low left ventricular ejection fraction, can be officially diagnosed as suffering from obesity-related cardiomyopathy. Obesity can cause hypertension, and hypertension might lead to hypertensive heart disease, which might lead to coronary disease or heart failure or arrhythmias. So how do we diagnose obesity? We know that obesity is diagnosed primarily using the body mass index. And the body mass index is very simple to calculate using the weight and the square of the height, using the metric system, and gives us a number that would be anything from usually values around 18 to 40, 50, 60. Normal will be below 25, and obesity is diagnosed when the BMI is above 30. Now, is BMI perfect? The answer is no. It's not perfect because a number of individuals might actually have significant amounts of body fat, but the BMI might be either normal or just slightly above the normal value. So those are the people that are called normal weight obese. BMI might actually overcall or overdiagnose obesity in individuals that are extremely fit, doing a lot of weightlifting, a lot of muscle mass, and therefore the BMI might be elevated, but they may not have obesity because the amount of fat is normal. So if you think about it, obesity, according to the dictionary, is defined as excessive accumulation of body fat. So obesity means excessive amount of fat. So the question is, why we base the diagnosis of obesity just on something that relates to the weight and not necessarily on the amount of fat? Well, the short answer is because measuring fat is not that simple, and it was actually very hard years ago. But in recent years, there are some technologies that actually allow us to measure body fat simpler than in the past. Those technologies include things like bioimpedance, that is a measurement of how the electricity is transmitted through the body. And those measurements can actually be pretty accurate. Other techniques include the BOD-POD, which is a way to measure the body volume by measuring the amount of air that is displaced in this capsule. And by knowing the volume, we can actually know the density, and by knowing the density, we can calculate body composition. Perhaps the tool that has the more future, because is relatively simple, is practical, and is available in many hospitals and medical centers, is the Dexa. Dexa, that is generally used to calculate bone density, can also be used to calculate body fat. It just requires a special software, but that's something that we use here at Mayo Clinic. What is important to recognize is that trying to calculate body fat just by the skin fold is not a good or a reliable technique. So please don't use that to calculate body fatness. Now, we know that obesity might also relate not only to the amount of fat, but also to the location of the fat. And it has been well known that obesity, particularly when the fat is in the abdomen, or what is called central obesity, might actually be a much greater risk factor for cardiovascular disease than just general obesity or total fatness. And the reason is because fat around the intestine is a type of fat that is very inflammatory and might lead to atherosclerosis much faster. So it's important to measure central obesity in all of our patients because that might actually be a much better predictor of risk than just BMI or total amount of fat. So things to remember. Number one, that obesity might cause many disturbances in organs and systems that will eventually lead to heart disease. Obesity might cause many different types of cardiovascular conditions, not just coronary disease. The body mass index is the current way to diagnose obesity, but has many limitations. And therefore, if you can calculate body fat, that would be ideal. And if you can also measure central obesity, is even better, because that will give you a much better assessment of the cardiovascular risk related to body adiposity. It is very important for physicians and all healthcare practitioners to recognize obesity in the clinical practice, because it has been shown that when we recognize obesity and when we tell our patients to lose weight, they are actually more likely to lose weight and to consider losing weight in the future. Thank you very much.